our viewer, listener, those of our colleagues at the remote centers, our international viewers, this is Christmas Eve, 24th of December 2020. We want to warmly welcome every one of us to today's National PTF briefing. The chairman of PTF, honorable ministers and members of the Presidential Task Force on COVID-19, this is a special way that we want to warmly welcome you to our national briefing for today. Without much ado, may I please invite the chairman of PTF to please come and inform Nigerians about further developments. The chairman, sir.
Honorable ministers, members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I can see that our friends in the media are on a holiday mood. You know, COVID-19 has refused to go on holidays. So we all have to gear up as we continue to inform Nigerians about developments in all the segments and fronts of our national response. However, let me welcome you and thank you to the national briefing by the Presidential Task Force on COVID-19 for Thursday, the 24th of December 2020. The Presidential Task Force wishes all Nigerians a safe and COVID-free Merry Christmas and a Happy New Year. As the President advised in his address to the Presidential Task Force on Tuesday, 22nd December 2020, please shelve all non-essential travels during this period and avoid large gatherings. You will recall that in line with the authorization of the President, a number of protocols were issued to states on ways to curb the spread of the virus in Nigeria. As a follow-up to this development, the Presidential Task Force met with the select team of governors on the platform of the National Economic Council and by extension, the Nigerian Governors Forum. The meeting was robust, and the governors shared their experiences on the implementation of these measures and pledged to push it further. One of the startling things that I realized on the day of the meeting, 4 of the governors that were on that platform have had a brush with COVID-19. So they were talking out of personal experiences. Even one of the deputy governors that was representing his governor, out of 7 of them, 5, including the deputy governor, have had an encounter with COVID-19. In his speech, the President made several pronouncements, including 1, the further extension of the mandate of the Presidential Task Force till March 2021. 2, authorization to ensure that violators of the travel protocols are sanctioned. 3, the plan for a comprehensive health sector reform. And 4, the determination of the government to pursue the issue of vaccines in a safe, effective, and cost-friendly manner. For us on the Presidential Task Force, we thank Mr. President for the confidence he has in our ability to deliver on the mandate, and we rededicate ourselves to more work. The successes recorded by the Presidential Task Force in managing the control of the pandemic since March 2020 could never have been possible without the support of our partners, being the media that took the message to Nigerians. We also thank the National Assembly, the subnational entities, meaning the states, the private sector coalition, the international community, development partners, as well as many well-meaning Nigerians, our security agencies, our foremost frontline workers. The list is endless, but I will single out our frontline workers and truly thank them for their commitment and resilience, even in the face of daunting challenges. On a personal note, I thank all our medical professionals, those in the services of driving ambulances or vehicles, those that take our samples for tests, for sheer exhibition of commitment and dedication to their work, because of the diligent manner in which they have put themselves on the line of duty at great cost to even their personal safety and welfare. I'm happy to announce that 6 members of my family this afternoon return home to share in the joy of the Christmas season. And it's as a result of what they've been able to do that I can have 6 members of my household back after 12 days of care in the treatment centers. As we commence the process of adding vaccines to the task, we wish to reaffirm that all aspects of the pronouncement of Mr. President will be approached with the seriousness it deserves. New guidelines have been developed and will be unveiled by the national coordinator. The task is huge, but our will is stronger this time. Accordingly, the PTF is working with the relevant MDAs on regulatory and certification issues before we go further on the subject of vaccines. In 2021, it's vaccines plus MPIs. As we make progress on this MPIs plus vaccine issue or phase, I urge the state governments not to close down their treatment centers. Rather, they should keep them running efficiently and smoothly, because the cases of infections are rising, and we must intensify our efforts to support the public sector laboratories with critical reagents, and the PTF expects the leadership of the federal tertiary health institutions to raise their level of testing and turnaround for results. The DG Nigerian Center for Disease Control will elaborate on this during this briefing, because the issues of the rising cases, the testing, and the turnaround has been brought to his attention. Similarly, the Presidential Task Force is aware of the global conversation on the new strain of virus discovered in the UK. We had assured Nigerians that our experts working with the World Health Organization are studying the variant strain and shall make a statement at the appropriate time. the representative of the World Health Organization will elaborate on this matter. On the international travel, especially from UK, South Africa, and some very high burden areas, we continue to evaluate the actions taken by various countries. We note that some of the countries that initially banned flights have now adopted the requirement already in place in Nigeria. We have also weighed the security, economic, and social implications of a full ban, especially when we consider the situation in our neighboring countries and the ECOWAS as a whole. The PTF shall increase measures pertaining to those high-burden countries to scale down the possibilities of importation. And for this, the National Coordinator will elaborate on the matter as appropriate. The Presidential Task Force is working assiduously on the turnaround time for receiving test results. We are working with the Nigerian Center for Disease Control to improve on this. Nigerians should expect improvement very soon. What has happened in the last couple of weeks is because they receive quite a lot of samples from different states of the Federation. It ought not to be so because all the states in the Federation have facilities for testing. So if that has been put aside, our appeal is that all those centers or laboratories should be open because there is a resurgence of the virus in our communities. I now invite the Honorable Minister of State for Health, thereafter the DG Nigerian Center for Disease Control, and the National Coordinator for updates on technical developments. I thank you for listening, and I wish you a Merry Christmas and a Happy New Year. My prayer is that 2021 will bring a new lease of life. All the interruptions that we have experienced in 2020 would recover in 2021. Remember, COVID-19 is not going on holidays, and it is not pretending to be on vacation. It would enjoy the ceremonies and the celebrations of Christmas with us, looking for the next victim to infect. So please stay safe as always, and have a good evening. Thank you.
My colleagues on the PTF, media representatives here present, ladies and gentlemen. The number of confirmed cases of COVID-19 has continued to climb, giving cause for concern. On the 23rd December 2020, we recorded 1,133 confirmed cases and 5 deaths, bringing the total number of confirmed cases in Nigeria to 80,922 from 912,114 samples tested. 1,236 people have lost their lives to this disease. We are also recording an increase in the number of passengers coming into the country. Last week, the number of inbound passengers increased to 20,208 against 15,805 the previous week. 270 passengers tested positive after 7 days against 129 that tested positive the week before. This represents more than 100% increase from the previous week. Our record shows that only about 60% of those due for testing present themselves for test. The implication of this is that many who have the virus could spread it in the community without knowing it. I therefore call on all those who arrive in the country to isolate themselves and present themselves for test on the 7th day. You will be saving a lot of lives if you comply. The life you save may be that of your own loved one. We held a strategic review workshop on the 21st and 22nd December 2020 to review activities and report of supportive supervision as part of our response to strengthen case management of COVID-19 cases. We shall ensure standards are maintained in the operations and activities at isolation centers, including training, logistics and supplies, as well as data management. In addition, a robust coordination meeting held yesterday, 23rd December 2020, with the chief executive officers of the federal tertiary hospitals and the team leads for the state's isolation centers in attendance as part of efforts to ensure coordination in the management of cases in all the isolation centers across the country. As we celebrate this Christmas, please be reminded of the importance of adhering to preventive measures. Wear your masks to cover your nose and mouth. Wash your hands regularly with soap and water, or use alcohol-based hand sanitizer. Observe physical distance and avoid crowded places. While wishing you all Merry Christmas, ensure that when you make merry, remember that coronavirus will want to feed as well. So take primary responsibility for your health, and please keep safe at all times. Thank you very much.
Directors, Permanent Secretary, gentlemen of the press, let me also start by wishing you a Merry Christmas and good end of the year as we proceed to that point, and remind you and everyone to celebrate responsibly over the next week or two. Comments will be fairly brief today. We've continued to see a significant increase in the number of cases across the country. Over 50% of our cases are young people aged 21 to 40. So we're watching this trend very carefully. It really indicates where transmission is happening in our country and what is driving transmission. So we have to bear that in mind, especially at this point in the year. But we're now at a critical point where every Nigerian has to take responsibility in protecting the country moving forward. Over the past few days, we have monitored reports of the virus mutation in the UK, South Africa, and a few other countries. But it's also important to establish some facts, what we know, what we still don't know, and what we're hoping to learn over the next few years. The most important fact to just put out there to calm everyone's nerves a little bit is that viruses mutate all the time. This is by nature. Some mutate quickly, some a little bit slower, but it is in the nature of viruses that constant mutation happens. And the emergence of a new strain or slightly different strain is not in itself news. It's not new. It happens all the time, so shouldn't be in the papers. What really is important is if that change is associated with a change in transmissibility, in change in virulence, i.e., a change in its ability to jump from one person to the other, is change in its ability to cause severe illness, or a change in its ability to cause death, or more death. So the change in the virus itself doesn't mean anything. Some viruses get stronger, some get weaker. This is a constant phenomenon of what happens with viruses. So we had those reports from the UK of this new strain that seems to be associated with an increase in transmission in the UK, and which is mostly predominantly circulating in those aged, started in those aged 12 to 18, but has now spread to most of the population. There appears to be a similar but independent mutation in South Africa that also seems to be associated with increased transmission. Now, you may recall that early in the outbreak, we reported the first sequence out of Nigeria. This is work done together with NIMA and the Africa Center for Genomics for Excellence in Genomics of Infectious Diseases at the Redeemers University. This is one of our most important partners when it comes to sequencing activities in Nigeria. So since then, we've been working closely together with this institution to continue virus sequencing over time and monitor the patterns of transmission in Nigeria. So when this new strain was reported in the UK, what we did was work with Redeemers University, and they then looked through the historical archive of viruses that had already been sequenced. And through that retrospective analysis, found two viruses that were similar to the one in the UK, but not the same. So had a few similarities, but enough for us to say that this did not originate from the same population of viruses. But it just shows you what we are able to do. But remember, this is just in two individuals. So what we're now going to do with Redeemers University is collect a selection of other viruses circulating in Nigeria now, so from the more recent cases, and try and compare what we have now to what we had previously in Nigeria, but also what is circulating abroad. So this is ongoing work that we'll be carrying out over the next few weeks to see whether we can explain some of the changes, some of the increased transmission that is happening in Nigeria, and to look at whether it is related to the virus or related, which is most likely to be the case, into behavior among individuals across the country. So this is ongoing work. It can't happen in a hurry. It's very complex. Sequencing is not a straightforward business. It's why we have only a few centers that are able to do it with the level of expertise needed. But I just want to ask Nigerians to rest assured that this capacity is here. We will be doing this work. There's no need to panic. In fact, what we all need to do is reinforce the things that we're doing already and what we've been asking everyone to do. Over the next few days, we have just deployed a new team to both the Federal Capital Territory and Kaduna State to support the response there. That's in a response to the escalation of cases across the country, and really to remind everyone that a lot of hard work is going on. Healthcare workers especially are working extremely hard. I'm really appealing to healthcare workers across the country. It's been a tough year, and everyone is tired, and we completely understand that. But really call on you to please persevere and work a little bit harder over this period. If you can postpone your leave, you will save many lives. If you're working in a laboratory and you're tired, we understand, we feel your pain. There's the same thing happening here. I lead a whole group of people that have had to cancel their own Christmas and Christmas plans, and will continue to work for Nigerians through this period. But we can't carry the burden of testing for everyone in Abuja. So we really need all the labs around the country to keep working so that not all the samples are sent down to NRL. We simply don't have the capacity to test for the many states that are sending samples to us. So if we've set up a lab in a state or in a federal teaching hospital or tertiary hospital or federal medical center, it is not the commodities that are a problem or the reagents. It's really the healthcare workers to persevere in the very hard work you have done this year and to keep pushing over the next few weeks, despite the very challenging period. My final word around testing is that there is some light at the end of the tunnel. From next year, we'll be introducing the use of rapid diagnostic test kits in certain settings. We've made a significant procurement that should come in January, and through that, we'll really scale testing and bring it much more closer, take it out of the labs, and make it able for people to use much closer to their patients. So this is some of the efforts that will be happening over the next 2 weeks. And this is really to encourage all of us to work together, especially laboratory staff, doctors, nurses, everyone involved in actually providing care, both clinical care and public health care to people infected. We've seen the numbers. Behind those numbers are people, and we need to provide them the care they need. And my final point, like always, is please to, if you do have to celebrate this Christmas, to celebrate responsibly. You know what to do. We have said it severally. Keep the numbers as low as possible. Postpone it altogether if possibly you can. If you can't, please, outside is better than inside. If you're inside, open the windows, keep the numbers low, wash your hands, wear your mask, even if you're the only person in the room wearing a mask. And there's all the peer pressure looking at you in the towns around Nigeria. I encourage every Nigerian to be bold, be the one person wearing a mask, be the leader. Thank you very much.
Members of the PTF, gentlemen of the press, good evening. I know we're all very tired and we're going into a festive season, so I will try and be as brief as I can, but the amount of information I'll provide will be quite significant. We will try and do a release by early tomorrow morning. So as you're aware, the numbers have been going up, and because of that, the PTF has met. We have looked at our guidance, and we have issued last week safety protocols. These safety protocols, in a way, what we are doing is we are rolling back from the phase 3 that we had. If you remember, when we had the lockdown, we went on to relaxation, and we went into 3 phases: phase 1, phase 2, phase 3. So we're now rolling back. This might be inconvenient to the general public, but it's still better than locking down. And it's an option, because it's a binary decision. Either we lock down or we start restricting. We are very grateful to those state governors that have been working with us, been collaborating really effectively, in particular Lagos, FCT, and Kaduna. They have already implemented some of these protocols that I'm going to announce. But just to clarify, these safety protocols are for every state, and we are asking that this should be the minimum that every state should apply. You can do more, but you certainly shouldn't do less, preferably. Starting off with general movement, just to remind the public that curfews are still on, 12 midnight to 4 a.m. And there's a reason for this, even though most of us will not be out around these periods. In terms of general movement as well, citizens are encouraged to refrain from non-essential movement. We are actively discouraging travel, both domestic and international, during the holiday season. Both international and domestic travelers must comply with existing protocols earlier issued by the PTF. In particular, international travelers must register with the Nigeria International Travel Portal, which is nitp.ncdc.gov.ng, or you can do a Google search for the Nigeria International Travel Portal and abide by the travel guidelines. In terms of general movement as well, we are discouraging people above the age of 60 and those with comorbidities from joining large crowds or moving around. Now is the time to stay home if you belong particularly to this particular group, because you're the ones that COVID would actually like to infect. You're the ones that are most likely to have severe illness if you catch COVID. Already our treatment centers in Abuja are fast filling up. In terms of land and rail transport, just to remind all vendors and service providers that they must abide by the stated stipulations of the Federal Ministry of Transportation. In particular, we are asking security agencies to enforce the use of non-pharmaceutical interventions, including the use of face masks, hand sanitizers, and temperature checks in all rail stations, buses, and motor parks across the country. In terms of working arrangements, the private sector, we are asking the private sector to please decongest their offices, reduce the number of people working in the offices, and encourage virtual meetings. Definitely should avoid large physical meetings, and offices should ideally be well ventilated. Encourage staff to work from home where possible. The use of face masks is mandatory in office spaces, whether it's a private sector or public sector. And personalized services must ensure that face masks are worn, so such as your hairdresser, for instance, people that come very close to you, or if you're selling goods or providing services. Mobile courts have already been initiated in some of the states to enforce on-the-spot fines and close premises that repeatedly violate rules. For the public sector, we've already announced that government staff from grade levels 12 and below should stay at home for the next 5 weeks. Don't come in, especially at the federal level. Permanent secretaries and chief executives will be held accountable from now on for enforcing non-pharmaceutical interventions in their domains, and frequent spot checks will be carried out. Non-pharmaceutical interventions, including the mandatory use of face masks and their proper use as well, not for covering your chin, but for covering your mouth and nose, must be adhered to in government offices as well as private spaces. For communal commercial spaces such as markets and stores, we will continue to conduct at the state level spot checks of commercial premises, and facility owners and managers will be held accountable for ensuring NPIs. And where this is repeatedly violated, those premises will be closed. And we ask state governments to please enforce this. For the hospitality and entertainment facilities, we've already announced this, but just to re-emphasize that all mass gatherings of more than 50 persons should stop. All bars, nightclubs, pubs, and event centers should close immediately. All restaurants to close except those providing services to hotel residents, takeaways, home deliveries, and drive-ins that will be allowed. But hotels may remain open but must observe non-pharmaceutical interventions. For schools, we're asking that schools delay their opening until at least the 18th of January 2021 to allow us to have enough time to work on flattening the current peak we are having, the spike we are having. Of course, schools that are able to do virtual teaching may open earlier, and schools must continue to observe mandatory non-pharmaceutical interventions. For religious centers, we're pleading with religious leaders, pastors, imams, to please work with us, because this is about saving lives. All gatherings linked to religious events should be limited to less than 50% capacity. This is to ensure physical distancing, and face masks must be worn at these events. And we will ask that the leaders please enforce this. It's for the best interest of you, of the people that you're leading, your followers. Gatherings of more than 50 persons, this is in the context of religious centers. Gatherings of more than 50 persons must be held outdoors. And we expect all religious centers to observe non-pharmaceutical interventions. For recreational facilities and sports, over the next 5 weeks, all recreational venues, gyms, and sport facilities shall remain closed. For those of you lucky to have weddings, parties, etc. during the holiday season, all informal and formal festivity events, including weddings, conferences, congresses, office parties, seminars, end-of-year events involving more than 50 persons are no longer allowed. Concerts, carnivals, and street parties are banned until further notice. Face mask wearing is mandatory and physical distancing must be adhered at these gatherings. We expect that the state governments will continue to work with us to enforce this. I will now take us briefly through the issue of international travel. As the chairman mentioned, and also mentioned by the DG NCDC, we continue to be concerned about the emergence of the new variant coronavirus in the UK and the additional mutant that was described in South Africa. The system that for travel in terms of ensuring the safety of our citizens and preventing the importation of cases in the country is one of the most strict. We're one of the few countries that do double testing. We're one of the few countries that have a travel portal where you have to go in and enter your details, including your health questionnaire, and pay for a test. Specifically for the UK and South Africa, the PTF has met and we've decided that additional measures will be required to ensure the safety of our citizens. So effective from 0001 hours on Monday the 28th of December, all passengers coming into the country from the UK and South Africa on direct flights must use the Nigeria International Travel Portal to register, fill in their health questionnaire. They must upload a negative COVID-19 PCR result with a validity of not more than 5 days, and they must pay for a COVID PCR test at day 7 of arrival in country. When you are leaving UK or South Africa, you need 2 documents that you have to present to the airlines. The first document, which we already have, is a negative COVID-19 PCR result. The second document is a permit to travel document, which we used to refer to as the QR code. For passengers leaving from the UK and South Africa on direct flights, they have to present the permit to travel to airlines in order to board. The only way you can get a permit to travel on the travel portal is by filling your health questionnaire electronically, uploading your COVID PCR result, and paying for the day 7 test. If you do not present a permit to travel, or you cannot present a permit to travel, the airlines are being directed not to board you. So if you are coming from the UK or South Africa, it's in your best interest before Monday to familiarize yourself with the Nigeria International Travel Portal and make sure you fill in your details, you submit or upload your COVID PCR result that has to be negative, and you pay for a day 7 test on arrival in Nigeria. The second enforcement we will have has to do with the issue of the 7-day self-isolation after you arrive. We've had a lot of debates as to whether we should institute mandatory quarantine or not. When people arrive, we've decided for the moment we will open a special register at the airport for all passengers arriving from these 2 countries. We would have an enhanced surveillance where these passengers will be contacted after they have arrived home. We will be checking on them to see if they are having any symptoms. But even more importantly, by day 7, we expect these passengers, just like any other passenger coming from outside, to unfailingly go for your COVID PCR test result, which you must have paid before boarding your aircraft. Penalties. So we have already mentioned right from September when we opened up the international airspace that there will be penalties for not abiding by the international protocol. Mr. President has approved at our meeting on Tuesday, from now on, particularly, specifically for those coming from the UK and South Africa, we will pay special attention to these flights. If you do not do your day 7 test by day 10, you will automatically go onto the suspension list. And your travel documents, your passport, will be suspended for a minimum period of 6 months. If you carry a foreign passport with a visa, we will revoke your visa. And because we are able to track, it's easier to track a smaller group of persons than a large number of passengers, which has always been the challenge we have. We are now able to enforce this specifically for passengers coming from these routes until further notice. In addition to that, over this weekend, we will publish the first list of 100 passport numbers, Nigeria passport numbers, that will be suspended for 6 months. We've already contacted these passengers, and we've confirmed that they have not had a COVID PCR test. We will not be publishing names, but we will publish the passport numbers. And we are asking from now on people that are traveling in to make sure that they abide by our protocols, because there will be repercussions if you don't, in terms of penalties. In addition to this, we will also be instituting the same penalties for people presenting fake COVID-19 PCR results at our airports when exiting, or if they are found to have presented a fake COVID-19 PCR result on arrival. For those that are exiting, we have a code that we have developed that we'll be asking the airlines to start using, which will entail entering the code for every result, a special code, onto a website that will tell you whether or not the result is fake. So please do not buy fake results and do not use fake results when traveling. You are putting others at risk if you do so. So again, just to summarize, there are new travel requirements for people traveling from the UK and South Africa, effective from 001 hours on Monday, the 28th of December. It is the responsibility of passengers to make sure they familiarize themselves with these new rules, and airlines will be informed accordingly. I would like to finally thank you for your support, members of the media, throughout the last 9 months. It has been a very difficult and challenging period for all of us, but I hope you'll be able to celebrate Christmas, as the DG and CDC said, in a responsible way and without COVID joining you. Thank you.
The Chairman for PTF, the Secretary to the Government of the Federation, Honorable Ministers, Member of PTF, ladies and gentlemen of the press, good evening. As introduced by the Chairman, when talking about the new variant of the virus, the COVID-19 virus, WHO indeed did receive information from the UK government, from the South African government, regarding the detection of the new variant of the COVID-19 virus that was circulating in both countries. It's a new mutation, but as Dr. Chikwe mentioned before, mutation in virus are quite frequent. It's not a rare phenomenon. So as virus circulates in the community, in the population, they change their appearance. It's a kind of coping mechanism to try to survive. So it's quite common. Ever since this pandemic began, there have been thousands of mutations detected over the world, but not all of them are significant. You will recall that at some point there was this D614G mutation that was detected, that was the main strain circulating in Europe and the US, and that also was detected mostly in Africa during the first wave. Now, with the second wave, we've seen a peak in the UK and in South Africa. And through sequencing, the scientists identify this new mutation, the 501Y mutation. One of the things that scientists notice, and what we know currently, is that that particular variant seems to spread much faster in the community, in the population, to such an extent that they tend to suppress the other strains. So they have a kind of survival advantage. In South Africa, data suggests that the population affected appear to be younger, not the older people. But what we don't know, there is not yet evidence as to whether that particular variant is responsible for more severe diseases. We don't know, so investigations are still going on. There is a question on whether that particular variant could affect the efficacy of the vaccines that are being deployed. That also, there are investigations going on with the manufacturer of those vaccines. So what WHO advised countries is to continue to perform sequencing to understand better how the different virus population evolve in the community so that appropriate measures could be taken. But whether the new variant or the variant that was predominant during the first wave, the non-pharmaceutical intervention are key, at least until an effective vaccine is deployed, distributed, and is able to protect the large majority of the population, which is some way to go from now. We have the opportunity to continue to use, at best, the tools we have. WHO encourage every country to communicate the virus population they detect in the different countries so that we could better inform control measures in the world. Right now, there are over 40 countries that have imposed travel restrictions to and from the UK and South Africa. And WHO continue to encourage the countries to communicate that information promptly to WHO through the international F regulation mechanism. And I know here in Nigeria, it's through the NCDC as a national focal point for international F regulation. So that's where we are now. There is no room for panic because it's just a mutation that is happening. But what's important is to understand the impact of that mutation on the community, in the population. The tools we have, they'll work. Observe adherence to non-pharmaceutical intervention, avoiding crowded places, washing hands with water and soap, sanitizing our hands more frequently, observing social distancing. All these measures work. That's what we have for now, plus proper contact tracing, case management, and other interventions. Thank you.
Thank you very much.
And my colleagues, my name is Rahila Lassa. I report for Voice of Nigeria. My question is for the national coordinator. At the last briefing, the PTF announced that civil servants on grade level 12 and below should work from home for the next 5 weeks. In line with that, we meet with the Office of the Head of Service to come up with modalities on the adherence of COVID-19 protocols by civil servants. But there is a physical verification exercise coming up from the 4th of January to the end of the same month as announced by the Office of the Head of Civil Service of the Federation. I want to know how the PTF will reconcile these two. Thank you.
The Chairman, sir, members of the task force, my colleagues, good evening. My name is Nancy Oyedia Oron from AIT. I would like to commence with the Minister of State for Health. So I want to talk about the vaccines. Across the world, there have been different beliefs concerning the vaccines. Take, for instance, the United States. It is estimated that about 27% of Americans have said that they will not take these vaccines, and majority of whom are Africans, meaning that a lot of Africans are saying that, well, we will not take these vaccines, and Nigeria happens to be, part of Africa. So I want to know, have you taken out time to do like an assessment, from Nigerians, if they want to take these vaccines, if they eventually come to Nigeria based on religious or cultural backgrounds? And secondly, all over the social media, I get to hear people saying, oh, Nigeria will acquire this vaccine at this particular cost. I just want you to give us the exact cost, what it will cost the country to acquire this vaccine for every single Nigerian. And I've also seen that a lot of people have said, well, it's going to be free, so I just want that confirmation from you. And finally, to the national chairman, sir, the PTF has been extended for another 3 months, and I would like to know what strategic method is the PTF coming up with at this time. This is the second wave, and we have been told that it's more dangerous than what we have experienced before. I want to know what is new that the PTF is coming up with. Thank you.
Good evening, Chairman and members of the PTF. I am Itaire Ikben. I report for the Nigerian Television Authority. For the national coordinator of the PTF, some citizens who arrived the country from the US through Lagos and have done their Day 7 PCRO test say they are yet to get their results 3 weeks after. 2 of them, in particular, who reside in Ibadan, we are told it's only Abuja that can send the results to them. So can the PTF respond to this? Then my next question can be taken by the PTF chairman or the national coordinator. We have seen very rowdy NIMSI registration centers in the last few days. The centers here in Abuja have been very chaotic in particular. What is the PTF's reading of the situation, which we all know could lead to a spike in cases? And is it impossible to enforce online registration for majority of the population? And for the DG of the NCDC, I want to ask, you have spoken elaborately on the fact that you are studying the variant strains collaboratively. I want to ask, have you established that we have the new strain or the new strains in Nigeria? Thank you.
Good evening all, Rachel Abuja. My question is for the NCDC boss. Sir, I would like to know what we are doing to extend our COVID-19 test menu. And so far we're doing very well studying the virus at the moment. I would also like to know if we're looking at studying the host response of this virus too. Thank you.
Mr. Chairman, members of the PTF, my colleagues, my name is Mohamed Salih Nazif. I work for Voice of Nigeria. My question goes to Dr. Aliu, Sani Aliu. In your submission, sir, you talked about opening a special register, especially for those people coming into Nigeria from abroad, in order to know how to track them. Earlier, you talked about people bringing fake PCR results, which is also a challenge. And apart from that, you complain of the same people paying their money as they are coming into Nigeria, but declining to come for their test. I am more concerned with this register. how are you going to handle this issue of register in case if they decided to give you fake addresses? Example, somebody coming from America and will fill in the register and say, I stay in Imo State, whereas maybe he's in Anambra or in any other parts of the country. So what measures are you putting to dictate and avert that kind of things? Thank you.
That is the out.
House. The question I have is from Nancy AIT, wanting to know how we're addressing the issues of vaccine hesitancy, then issue of costs, and then whether the vaccines will be free. Well, at the moment, we have in place a technical working group looking at the issues surrounding vaccines that are currently available. And I can assure you that more vaccines will be available as we move on. Now, the issues of vaccine, there are so many things that we need to consider, which will not make it possible for us to tell you precisely what the cost implication will be. First is availability. Is the vaccine available? And don't forget that we are not manufacturing. So, and the natural tendency is for the countries where these vaccines are being manufactured to take care of their own people first. So the issue of availability is there. Now, even if it's available, the next issue is it accessible? It may be available without being accessible. So that also comes up. Then the issue of affordability. Is it affordable? Because the vaccines are not free. They are not free. So that issue is also there. The issue of the management itself or administration of the vaccine is also there, that is being considered. And linked to this is the logistics of supply, the storage, distribution. The vaccines come at different costs, and these are the various issues being looked into before we can then determine how many of these vaccines we will need. For those that we have at the moment, they will require 2 doses at intervals of about 3 weeks to 4 weeks. So that means if you get 100 vaccines, that means it will be for 50 people. Now, you also want to determine the priority groups, whether the elderly, whether the frontline health workers, and maybe those with comorbidities and all that. These are a whole range of issues that we will need to work out. Then again, the vaccines, they have different storage temperatures. There are some that you need to store at temperatures at minus 70 degrees Celsius. There are some that can be kept at or stored at the regular temperature of the fridges, that is between +2 degrees centigrade to +8, which these are the usual temperatures for the routine vaccines for childhood preventable diseases, vaccine preventable diseases like measles, polio, and all that. Some are at minus 20 degrees. So these are the various things. We have to look at the logistics that will be involved in the supply, transportation, storage, and all that of these vaccines. Then, of course, the cost is also there, which we need to work out. So we have a technical group, like I said, trying to work on these things and then be able to determine which of these vaccines, and we're not restricting ourselves. We want to get help where we can get the help. And of course, don't forget that even when the vaccines are available, they still have to undergo the certification of our own regulatory body, which is NAFDAC. So we won't just go and take any vaccines without subjecting it to a regulatory process in the country. But having said that, it's also important for me to say that we're already part of the COVAX vaccine facility, which it's a group, a global group that is out there to ensure that there is vaccine availability as much as possible, and then, of course, distributed in an equitable fashion. Gavi. So all these things, we have the group working that will advise us as appropriate. You recall that earlier in the week, we met with the leadership of the Senate that tried to look into all these issues, and they are willing, the National Assembly, happily enough, is willing to support the country, but we just want to be sure that we get all these things right, and that they are willing and ready. And of course, Mr. President has also given that matching order for us, for PTF to look into, because that's what will occupy possibly the greater half, if not the whole of 2021. But I can say that the country will be looking at covering 70% of the population for us to be able to get what we call the herd immunity. So if you make that projection, 70% of our population, and we will then know what may be or what we might be looking at in terms of cost element, and based on the cost of particular vaccine we invariably settle for. But where efforts are already in place in that regard, I mean, looking at the nitty-gritty and all the things that will be involved. The vaccine, this is the last question, whether it will be free. Yes, it will be free. And that is the commitment of the government of Nigeria in that regard. Thank you very much. Well, of course, we also say that we will also need to do a lot of reaching out to the people in terms of education, because a lot of hesitancy may just be a factor of misconception and ignorance or myths. So which we will have to reach out to people through the various groups, the political leaders, the religious, the community leaders, and everyone, that we can reach out to. Don't forget that we had some issues like that before regarding polio. We were able to overcome this through appropriate education and the efforts to disabuse the minds of the people. Thank you very much.
I think it was Mitari that asked if we have new strains of the virus circulating in the UK and Nigeria. We haven't found that strain, but also it's not something we have been looking for on the go. To find new strains, you have to sequence. And you have to sequence a certain number of viruses longitudinally over time. It's a lot of work to sequence viruses. It doesn't change the diagnosis, it doesn't change the public health management. So our focus has not been on sequencing. So we've sequenced some viruses in the past. We haven't found it. It's where we found the two that are similar, but are not the same. So what we're now doing is sequencing a random selection of those we've collected already to see whether that strain is circulating. Is it likely that it's circulating? Yes. There's a lot of travel between the UK and Nigeria. Viruses are viruses, they circulate. This virus, by the time other European countries look sufficiently, they'll find this virus. It's very unlikely that this virus is not already spread in many other countries around the world. The issue is how many of it and how much of it do you find. Very few countries in the world do as much sequencing as in the UK, right? Even in Europe, even in the US. No, very few countries sequence a significant number of virus longitudinally to find that the strains change over time. So every other country around the world right now is looking back at the viruses they have they've found to sequence them to see whether they can find that similar virus. But this takes quite a while to do, so it's not a straightforward process. Rachel, thank you very much. There hasn't been any significant change in the host response to these viruses, whether it's the new one or the existing strains. You know, when you say change in host, it really means how humans react clinically. So does it cause more severe illness or a different type of illness or more mortality? We haven't seen any of those changes. And the colleagues in the UK haven't seen those changes with the new variants either, or in South Africa. But a lot of work is going on now to study these in more detail. I require some time. But everyone in the world is focused, all the reporting focused on the new strains. The reality is the public health response doesn't change. What we have to do now doesn't change. The vaccination doesn't change. The diagnostics don't change. So, but it's important to know that viruses can mutate, follow it, and study to see if there are any implications for public health. But for now, even in the UK, yes, they've announced a new strain of virus, but what they're doing about it still hasn't changed. They're just reinforcing the measures that they have already implemented in many parts of the country. Thank you.
Yes, so the private laboratories are individual laboratories. You pay, you get a service done. If that service is not being provided properly, then you need to reach out to them, complain, and also reach out to the authorities. The testing, as I said, is done by private laboratories, but the portal is run through the Lagos State government. So you can reach out to the Lagos State Commissioner of Health if you're still not getting your results. To be honest, I'm surprised because most of the private laboratories are actually very efficient. You get a sample taken and the next day you get a result. So this is quite unusual. And I'll suggest the persons involved to reach out to the relevant authorities or let us know the name of the labs and we'll be able to chase it up. But definitely they run their own private businesses. It's not a governmental laboratory. In terms of the issue of the verification exercise by the head of service, actually the head of service issued a circular with regards to limiting the number of civil servants from grade level 12 and below. I'm sure by January there will be further clarification. One option, of course, will be for them to stagger the verification exercise. And the same applies to NIMSI. We've been discussing with NIMSI. I've spoken to the DG twice, and I'll be reaching out to the Honorable Minister as well. As far as we're concerned, the limitation on mass gatherings to less than 50 applies across the board, whether you are a government or a private entity. It's the same. It's the same rule, and we expect it to be abided by. The challenges they are having is not in terms of their premises, but it's actually in terms of the people that are outside their premises that are trying to get in. But they've already given us assurance that they will comply with our protocols, which, of course, we are sure they will. In terms of the special register, just to clarify, I didn't say a special register for all international travelers. What I said was that we will maintain a list or a register for all those that have come in from UK and South Africa so that we will have greater clarity in terms of separate the wheat from the chaff and have greater clarity in terms of those that are coming from these particular areas that are of concern and then follow them up properly. The reason why we talk about the permit to travel or the QR code is because you can only generate the QR code if your documents are electronic. So it's very easy for us to go in and check where you are, where you're coming from, what your health questionnaire says, etc. But at the end of the day, we have to rely on people's honesty. If you tell me you're coming from Mars, how would I be able to check? So I have to, at a certain stage, I have to rely on whether, if I ask you whether you're having a fever or you're having a sore throat or you're coughing, I still have to rely on whether or not you're saying the truth. And we expect the vast majority of the public will be responsible and will say the truth. Thank you.
A question from WHO, but I want to comment quickly on the issue of the vaccine and the way vaccine work. As you know, when you receive a vaccine, it trains your immunity system to respond to an infection from a pathogenic agent, from the virus. It trains your immune system so that once you are infected, you can produce the antibodies to neutralize the virus. The more people there are out there who have the immune system trained, the less the virus will circulate in that community. And that's what the Honorable Minister of State referred to when he spoke about herd immunity through vaccination of at least 70% of the population. So in reality, we take vaccine to protect our community while protecting ourselves. There are more than 200 candidate vaccines. About 40 are in clinical trial. Until recently, there were about 10 at very advanced stage of clinical trial, and there are 4 that are being introduced in some countries, mostly the high-income countries. There are another 4 or 5 additional that have been added to the portfolio that are potential candidate vaccine. And through the COVAX facility, which is a collaborative partnership between Gavi, the Coalition for Epidemic Preparedness and Response, and WHO, evidence is being studied, compiled. Resources are being mobilized. Right now, the facility has secured about over 2 billion doses of COVID-19 vaccine, which will be distributed through the participating countries, including Nigeria, to cover at least the first 20% of the population, which is composed of the most vulnerable population. But I want to emphasize the message here. We all have a role to play to fight vaccine hesitancy. We have the moral obligation to protect our community. So we need to contribute to sensitizing our community so that we don't take COVID vaccination as a ground for political debate. It's a matter of survival. If we are to halt to stop this pandemic that is already full of negative consequences. It's very important. Even before the vaccine is fully deployed, we'll still need the current measures, the non-pharmaceutical intervention. We'll still need to adhere to them. In the early stage, next year, it will be mostly about vaccine, but it will not be vaccine alone until we reach herd immunity. So we have tools that we can use, but we have the obligation to make sure that the community accepts the vaccine, because that's the only way we will survive and get out stronger out of this pandemic. Thank you.
Thank you very much.
Thank you so much for your patience. Nancy, you did ask what is new. Well, a lot. One of it is that we are not going on vacation. Ordinarily, by this time, even from your places of work, you would have asked for a time out to go and visit loved ones and family in our various communities, which we normally utilize this time of celebration to get back with family so that the bond of family relationship is not torn into pieces. But 2020 is a different scenario altogether. We're stuck here because we've got job to do. We have a responsibility to continue with driving the message home that we are rather in a very difficult situation as a people, as a country, and globally. If you follow the news all over the world, we've returned to the experiences of March, April, where we're just running helter-skelter as humanity, trying to find ways of dealing with this ravaging pandemic. Even with the arrival of vaccines on the scene, most countries are not abating the ravaging effect of COVID-19. Unlike the country rep of WHO rightly observed, to be able to tame this virus will be a combination of two major things. Yes, vaccines are there, and the administration of vaccines, which is the vaccination aspect of it, will take a while. But before we get there, let's use what is readily available. And that's why I said in my statement that it's a combination of vaccines and the non-pharmaceutical interventions. That is one of the things that would be able to help us reduce the number of infections and correspondingly reduce fatalities as we try as much as possible to protect the vulnerable in our population. The other question came from Mitare with regards to the NIN registration and the overcrowded nature of the processes. Well, it's another fundamental flaw in our culture. That's the truth. We have to accept it, and we need a paradigm shift in that. Orderliness is totally out of our culture. We can't be orderly. Most of you here have traveled to different parts of the world. When you are living in Nigeria, it's chaotic. But you land in the airports of other climes. Somehow the anointing of order comes upon you. Believe me, the anointing of order comes upon each and every one of us. And we begin to behave in an orderly fashion. If they say don't put on your phones within the border control area, you switch off your phones. If they say you have to queue and walk through the queue at a paced distance before you are attended to, and there are clear demarcations of lines that you cannot pass. When you get to the border control officer, you stop. We all stop, don't we? But after a period of 2-3 days and you are on your homeward-bound journey, immediately you are checked in and you jump into the aircraft. Chaos and confusion starts again. Don't wish to see the experiences on arrival. So it's a fundamental flaw in the way we do things. And it will require a joint effort of everybody to be able to have a tweet and a paradigm shift that we need to be orderly. So it is not the fault of NIMS. or NIMSI, the agency that is charged with the registration process. But everybody wants to get registered at the same time. It's not possible. The administration of the registration too has to be well spelled out. And people can be assigned times. There could be a possibility of setting up the processes, and people could be assigned times when you come up for the registration. The fact of the matter is that how many people will even stick to their time and turn up for those registration? You see, it's a cultural thing, but we cannot pretend and continue to behave in such a manner and always give excuses for it. It's not right. As a people, we are so resourceful, but the level of our disorderliness has not helped us. It has not even helped our image. Most countries you go to, particularly, we were talking about British Airways. You know that we were the last, the Abuja-bound flight is always the last or second to the last out of Heathrow. And you have to walk a long distance because at our checking in points, we are always very chaotic. So they decided that probably we need to walk a long distance, but then we would have come down a little bit. You can see this thing playing out. So I think, and I totally agree with you, that the way I saw people congregating there, they were not wearing masks. And the crowd was a multitude, and they were pushing and shoveling. Obviously, if you have one infected person there, that becomes a super spreader event. So I hope I will ask the Secretariat of PDF to interface with the management of the National Identity Management Commission so that at least there will be some semblance of orderliness. And also the kind of instructions that come out and the timelines. You don't give 1 week for Nigerians in their millions that have not registered to be able to conclude that exercise. So there must be a planned out timing, and so that the registration can be staggered. But we would advise them that that is not the best way to go about it, because it is going to create a lot of clusters of infection for us. In the quest to get a national identity number, you would get something that is more than a national identity number. And that can be some elements of, create some elements of health hazard and dangers for your families. I think the most important lesson for us for this season, because I know a lot of people, there's vaccine hesitancy, but a lot of people too are very expectant and very excited about vaccine and eventually the vaccination. But the whole lot of it requires a lot of administrative processes, logistic processes to be in place even before the vaccine shows up. You've heard about the quest of our acquisition and how many people will be on the front line of access to vaccine. But I've said this consistently, and I will remain on it as my message ending today and preparing us for the festivities, that this is your greatest weapon. This is the vaccine that you have now, the face mask. Before you get on the queue to take a jab on your arm, this is the one that can protect you and save you. And My appeal to our countrymen and women is that during this season of celebrations and festivities, the non-pharmaceutical interventions are our greatest weapon, and it is the vaccine that comes at a very limited cost right now that we can deploy and tame this second resurgence that we are seeing, which has remained very virulent and very dangerous and infectious. I shared the experiences of my household with you here between March and November, except for the stride of one driver that we had even asked to stop coming to work as part of the precautions to reduce the number of people that were accessing the household. Not a single infection. But in 2 weeks in December, 9. To the glory of God, at least 6 have returned home today after having spent 12 days in the treatment center. We're trusting that the remaining 3. But among the remaining 3 that are remaining is a 1-year-old child. And this is my message for the youth. Of all those that were infected in my household, they range from the age 1 to age 17, to age 23, to age 27, and to age 31, and then 30-something, and about 40-something. So they fall within the age bracket of people supposedly youthful population, the ones that have got all the stamina, all the immunity, and they were virtually all asymptomatic. So what is the message? That this new wave war, probably it has come because the youthful population thought that the first wave was for people within my age category and above. So they are getting their own share now. And the fatalities has not distinguished between age. If you ask the DG, Nigeria Center for Disease Control, the Minister of State Health, they will tell you, younger people are dying, middle-aged people are dying, older people are dying. So COVID-19 is no respecter of office, no respecter of person. The only person it respects is the one that has purpose decisively to ensure that they comply with the non-pharmaceutical interventions. Even then, you are at great risk because oftentimes we remove our mask either to eat or to drink. And COVID-19 is lurching at the corner, just looking for the next victim, the next carrier that will take it to its destination. So my appeal to Nigerians is that we must take this fight seriously. Like I shared with you on the platform on Tuesday when we had the meeting with the subcommittee of the National Economic Council. There were about 6 or 7 members. 4 governors have been infected, 1 deputy governor. So it's no joke. As we were speaking, 2 were still in isolation, in treatment. So this is not the time, like I said in my address 2 days ago. We've gone past the politics of COVID-19. This is real hard work now. And I want to thank you, members of the media, for your resilience, for your determination, for your commitment in the course of this fight. I believe working together, we will be able to overcome the dangers that are ahead of us and be able to navigate our people consistently by remaining on the stream of our narrative. Comply with the non-pharmaceutical interventions as we await the arrival of vaccines. Thank you. I wish you a Merry Christmas and a Happy New Year And God bless you. Stay well, stay safe. Thank you.
Thank you very much, the chairman of PTF. You've really driven home this deliberation. So to conclude, please permit me to invite the Permanent Secretary General Services Office, Dr. Namdi Berry, to please come here and then tell us a recap. Sir.
The Government of the Federation, honorable ministers here present, and all members of the Presidential Task Force on COVID-19. Gentlemen of the press, good evening, everybody. We have listened to the very well-selected words from the chairman, and they say a word is enough for the wise. So it is for us to imbibe what he has asked us to do, in addition to all that we know already, so that we can overcome this challenge and overcome the season we are about entering. A few issues that I need to re-emphasize. One, that the cases are rising. And what this simply means is that we have to watch out and be more cautious than even before. So in that case, you are advised to shelve all non-essential travels and, of course, avoid crowded gathering. At the same time, my colleagues, the permanent secretaries and all accounting officers, as well as chief executives of MDS, are advised to take responsibility for the adherence of the non-pharmaceutical interventions by their subjects, so that we can all fight this battle together. Another word of advice is that COVID-19 is not going on vacation. It's not going on holiday. And as we marry, the virus is also looking for where to feed from. So in that case, we advise not to make ourselves victims, not to present ourselves as praise for this virus. So in that case, you tread with caution. You also advise that over 50% of the infections recorded so far reside with the youths. And what this simply means is that the youths, you are advised that during this season of Christmas and the New Year, we know how the youths move around, how they mix up. So it is now a big caution for you to realize that cases recorded, over 50% of such cases are carried by the youths. What this simply means is that the youths, you are advised to tread with caution in all your activities during the period, as well as people over the ages of 60 and above, and those with known comorbidities. You're also advised to stay at home and, of course, take care of your families. This is not a time for mass gatherings, for social gatherings, for meetings, for village associations and things like that. Stay at home. This is a very dangerous period for your age category, as you remain very dangerous, endangered species. In summary, you are advised to remember the basic guidelines, and I want to rule them out again. First and foremost, you are advised to always wash your hands with soap and water. Use alcohol-based sanitizers from time to time. You're also advised to wear your mask, and not only wearing your mask, wear them properly. The mask is not for the chin, it's not for the jaw. The mask is to cover the nose and the mouth at all times. Also observe physical distancing, especially at this period that is characterized by festivities. avoid crowded places, and celebrate responsibly. Above all, do your tests when the need arises. Remember all the guidelines that you have been given, and in that case, you stay alive as we celebrate this season and hope to meet again in 2021 to continue to fight this battle. God bless you and Merry Christmas to all of you. Thank you.
Thank you.